So you've just had a C-section and met your new baby. It's a massive, life-changing moment. But the journey isn't quite over. Those first few hours right after the surgery are super important, a really critical time for your recovery. In this explainer, we're going to walk you through exactly what happens in the recovery room step by step. The goal here is to take away the unknown so you can go into this feeling calm, prepared, and in control.
I love this quote from Dr. Prashanth Kim Nuji because it just perfectly captures the why behind the recovery room. It might feel like a delay, keeping you from your family, but it's not. It's actually a planned, essential part of your care. It's all about giving that anesthesia time to wear off safely while your medical team gets a really solid handle on your pain control right from the start. So, before you head to your regular room on the ward, you'll make a pit stop here, in the recovery room. And look, it can feel a little intense. There are monitors beeping, and you'll have a nurse dedicated just to you. You're probably going to feel absolutely exhausted, maybe a bit overwhelmed by it all, and that is 100% normal. Just think of this as your personal, safe space to start healing.
Okay, one of the first things that can really surprise new moms is this intense, uncontrollable shivering. Like your teeth might be chattering, your whole body shaking. It can be pretty startling, but I really want you to hear this. It is an extremely common, totally harmless reaction. It's just your body's response as that spinal anesthesia wears off. Your nurses know all about it, they'll pile on the warm blankets, and I promise it'll pass.
Now, your body has just been through major surgery, so for the next little while, it's all about making sure everything is stabilizing just right. To do that, your nurse is going to be checking your vital signs pretty often, usually about every 15 to 30 minutes. You know that automatic blood pressure cuff that squeezes your arm all by itself? Yep. You'll have that, plus a little clip on your finger to keep an eye on your oxygen levels.
All right, let's talk about a check that can catch people off guard, the fundal check. A nurse is going to press down, and I mean pretty firmly, on your belly. And I'm not going to lie, it can be uncomfortable. But this is probably one of the most important things they'll do. They're feeling for your uterus to make sure it's clamping down and getting hard, kind of like a tight ball. That's exactly what it needs to do to stop any excessive bleeding. For your safety, this check is a total non-negotiable.
The next big milestone we're waiting for? Getting the feeling back in your lower body. Right after the C-section, your legs are going to feel like, well, just two massive heavy sandbags that you can't move at all. But don't worry, slowly but surely, that spinal anesthesia will start to wear off, and sensation will creep back in.
This timeline here breaks it down perfectly. The whole thing usually takes about 2 to 4 hours. You'll start with that heavy, tingly, pins and needles feeling, which will gradually work its way down your legs. And that first moment you can actually wiggle your toes again, that's a great feeling. That's how you'll know you're on your way back.
Okay, this is so important. We need to bust a common myth right now. You might have heard people say you need to lie perfectly flat and still to avoid getting a headache. That is old, outdated advice. The reality now is that as soon as you can start to feel your feet, we want you to do gentle ankle pumps. Just flex your feet back and forth. It seems like such a small thing, but that movement is absolutely critical for preventing dangerous, even life-threatening blood clots.
Let's talk about pain, because managing it well is a huge part of a good recovery. And here's the secret. The goal is not to wait for pain to show up and then try to chase it down. Nope. The strategy is to stay ahead of it. We use a layered approach to make sure the medication is already working before you even start to feel that incision.
So how do we do it? Well, while you're still numb from the anesthesia, it's common to get a rectal suppository. Now, I know that sounds a little strange, but it provides fantastic, long-lasting pain relief right where you need it, and it's less likely to make you feel nauseous. You'll also have your IV line, which is giving you hydration and medication. The real key here is that round-the-clock dosing. It's designed so the pain never really gets a chance to spike.
And I cannot stress this enough. This idea of just braving through the pain or being tough, it's a myth, and it's a dangerous one. When your body is fighting off pain, it can't focus on healing. It actually slows down your physical recovery. It makes everything harder, from just shifting in bed to having the strength for those first precious attempts at breastfeeding. So please let the team help you manage the pain. It's a vital part of healing.
Okay, so we've talked about your vitals and managing pain, the stuff you can kind of see and feel on the outside. But your team is also keeping a super close eye on how your internal systems are waking back up after the surgery, especially your kidneys and your digestive system.
You're going to have a urinary catheter in, which just drains your bladder automatically. And this leads to a little pop quiz. What's the magic number your nurses are looking for? How much pee in an hour tells them that your kidneys handled the surgery like a champ?
And the answer is 30 milliliters per hour. Now, that might not sound like a lot, but for your medical team, seeing that number consistently is incredibly reassuring. It's like a little thumbs up from your kidneys, telling everyone they're working just fine and your blood volume is nice and stable.
So, what about eating? I know your family might be excited to bring you food, but your whole digestive system is kind of sleepy after an abdominal surgery. It's just temporarily shut down. That's why, at first, you'll only be allowed little sips of water. If we introduce solid food too early, it can cause a lot of painful gas, bloating, and even vomiting. Only after a doctor listens to your belly and hears that your bowels are waking up will you get the green light for liquids and then soft foods.
Okay, once your vitals are steady, you've got feeling back in your legs, and your pain is under control, you graduate. You'll be moved from recovery to the regular ward. This is a huge milestone. But your job of paying attention to your body isn't quite over. Now, you need to be your own best advocate and watch for a few critical signs.
Please, take a mental screenshot of this. Burn these into your memory. You need to call your nurse right away if you are soaking a big maternity pad in less than an hour, or if you feel super dizzy or see black spots when you try to sit up. And finally, if you get a sharp, burning pain at your incision that your regular pain meds just aren't touching. Don't ever hesitate. That's what the call bell is for.
So there you have it. We've pulled back the curtain on those first few hours post-C-section. Every beep from a monitor, every check from a nurse, every strange sensation you feel, it all has a purpose. And it's all designed to keep you safe and comfortable. Knowing what's coming and why it's happening, that's not just information, it's power. So the final question is for you. Now that you know all this, how can you use it to have a calmer, more confident recovery?